everyone, it's Eleni. I'm here in the kitchen with Chef B, and today we are not talking about a recipe, we are talking about SIBO and what is the SIBO diet. So before I get into anything, I just want to say that this diet is for those individuals who have been clinically diagnosed with small intestinal bowel overgrowth. Make sure if you see some similar symptoms that we're discussing, if you think maybe you have SIBO, that you consult with your doctor first before you make any kind of dietary interventions or start adding any sort of supplement to your daily regimen. So when you have SIBO and food is passing through the small intestine, the bacterial overgrowth interferes with the absorption of nutrients there. The small intestine is where we do the majority of our absorption in terms of the vitamins and the minerals that are going into our bloodstream from our diet. So the bacteria being there is not a good thing. This bacteria will release gas essentially and cause a lot of unpleasant symptoms like bloating, abdominal distension, diarrhea, and even constipation in some cases. So again, this diet is something that is intended to alleviate some of those symptoms. A lot of times in terms of a treatment regimen, a doctor, a physician will prescribe an antibiotic for their patients. There's a lot of tests that you can do that will confirm a diagnosis, like a 2-hour breath test, a 3-hour breath test. You can do a stool test, lots of different things. So again, really important that you are clinically diagnosed before going into such a comprehensive and intense diet plan like this. So in terms of dietary interventions, there's multiple phases to the SIBO diet in terms of eliminating the bad bacteria and restoring the good bacteria. The first phase is a low-FODMAP diet, and we actually did another video on that. We're going to link it to the bottom of the page so you guys can go and see that. I highly recommend that you watch that video first before you jump into a different phase or make the mistake of trying to follow a different regimen instead. But that is the first step, low FODMAP diet. Check out that video first. Okay, so here we are, phase 2. This is called the GAPS diet, or the Gut and Psychology Syndrome diet. And within this, we are focused on repairing the gastrointestinal tract, the lining in the small intestine, and we're focused on rebuilding the beneficial gut bacteria here as well. So we're adding in lots of nutrient-dense foods into your daily regimen. There are a handful of foods that you're going to continue to avoid in here though. So no grains, we're still avoiding grains. You're also avoiding processed sugars and just processed foods in general. And the other thing you want to keep in mind is non-organic meat and dairy. That's also another big one. Stick with organic and you'll be good to go. This is one of the more complicated diet regimens. And again, I don't recommend getting involved in it unless you've consulted with your doctor and have been clinically diagnosed with SIBO. So if you have questions, if you're one of those individuals, come into the office, make an appointment. That way we can really, sit down and go over everything together. So check out the quick tip sheet. We will have that at rawwellness.com for you. And if you have further questions, you can always give us a call at the office or come in for a visit.